Hi, this is Dr. Sandy Ziya. I practice functional medicine. What is functional medicine anyway? There seems to be a little bit of confusion as to what functional medicine is, and that's why I'm here today. I really want to dispel any confusion about what functional medicine is and what it means to me and my patients in my practice. We hear a lot of terms being thrown around today. There's alternative, there's holistic, there's integrative. And I can't speak to what all of those different indications may be. What I can tell you is how I work at Meridians and Marathons in my practice. In functional medicine, to me, I look at the entirety of the person. So if you present to me with a specific symptom or a specific disease that you're struggling with, I don't just attempt to put a Band-Aid on that and fix that one symptom. What I do instead is I look at the entirety of you and your lifestyle. And then over time, we look at how we can create a better, healthier version of yourself by looking at all of the inputs that make you you. What are some of those inputs? What are the kinds of things that I'm talking about? When I say inputs, I'm not just talking about the pharmaceutical drugs that you input your body. Instead, I look at what kind of exercise do you undertake? Do you have an exercise regimen? Is it too much? Is it too little? Is it just right? And what's optimal for you? Further, we discuss sleep and sleep hygiene. When do you go to bed? What's your sleep and wake cycle? What kinds of things do you do when you're in bed? We also talk about your social life. What kind of community or tribal support do you have? We don't talk about these kinds of things in conventional medicine. And in standard care, what we instead do is we have a therapist, we have a physician, we have a coach, we have a girlfriend, and we have all these competing inputs. And those are intended to be in our best interest, but they don't know us as a whole person. And what we do when we are interacting with them is we piecemeal how we feel that day and what we want them to know. Part of that is because we don't have a relationship established where the long-term interest and trust is there, where you know that you have someone that you can go to talk about all of these things. In functional medicine, one of the other differences in what I do is I refer myself as a jack of all trades. What does that mean to you as my patient? What that means is I know a little about a lot of different things. Why is that beneficial? That's beneficial because 90% of what you're going to present to me with are things that we can make modifications along the way in any kind of presentation, whether it be cardiac care or musculoskeletal issues, sleep. We can make those modifications without having to do a major intervention. So we don't necessarily need a urologist or a cardiologist because I'm going to perform the intervention before that kind of critical care becomes required. It's optimal for you for multiple reasons. It's going to save you time. It's going to save you money. It's going to save you a lot of drama and stress. Further, we're going to be able to make a health span part of your lifestyle. Health span meaning a fulfilling, long life of doing what you want to do disease-free. Part of that means we're going to work together in a coaching environment. So I'm not going to just have you come in and see you once a year or once a month and wish you the best and hope that you're compliant with all of the interventions that I've suggested. You're going to be hearing from me. I'm going to be reaching out to you, checking in on you, making sure that you understand all of the asks that I've sent your way and see what I can do to help make you succeed. I'm not going to let you go without being your partner and your accountability. So when you're ready to have this conversation about functional medicine, reach out to me, Dr. Sandy Ziya, and I will help you get there.